This week on the VSU News podcast, I speak with Robin Marty, author of A Handbook for a Post-Roe America and operations director of the West Alabama's Women's Center. I called her to talk about the state of abortion access in Alabama and the recent announcement from the state's attorney general that he would be looking at potentially prosecuting women for trying to receive abortion pills under the chemical endangerment law that they already have on the books. This from a January 11th Washington Post article on the subject. Alabama's Attorney General, Steve Marshall, became the most prominent Republican official yet to suggest that pregnant women could be prosecuted for taking abortion pills, saying in recent days that a state ban targeting those who facilitate abortions does not preclude the state from seeking to penalize women under other existing laws. Since that was saying the quiet part a bit too loud for the more mainstream anti-choice activists in the country, his office has since backed off, saying to the Washington Post again that he would be focusing his ire at the pharmaceutical companies that are distributing them. Quote, "The Attorney General's beef is with illegal providers, not women," said Cameron Mixon, Marshall's deputy communications director. That was about a month ago. Since then, Alabama and 19 other state attorney generals have sent letters to CVS and Walgreens to not send mifepristone, an abortion drug, to their states threatening legal action, saying, "We emphasize that it is our responsibility as state attorneys generals to uphold the law and protect the health, safety, and well-being of women and unborn children in our states." To quote CNBC, the Food and Drug Administration approved mifepristone more than 20 years ago as a safe and effective way to terminate an early pregnancy. The FDA says scientific and real-world evidence demonstrate that the pill is safer than surgical abortion and childbirth. This isn't the only threat to abortion access currently in the works by conservative states trying to effectively prevent women across the country from receiving health care. In Texas, there is a case in front of a federal judge brought by Alliance Defending Freedom, which is a group that the Southern Poverty Law Center has designated a hate group. To quote the SPLC, the ADF is specifically an anti-LGBTQ organization that has defended state-sanctioned sterilization of trans people abroad, contended that LGBTQ people are more likely to engage in pedophilia, and has claimed that a, quote, homosexual agenda, quote, will destroy Christianity and society. They seek to pull the FDA's clearance of the abortion pill, mifepristone. The groups went judge shopping in their case and got exactly what they were looking for. Quoting an excellent Bloomberg article that I'll link in the show notes, quote, "The ADF filed its complaint in federal court in Amarillo, where the only district judge is Matthew Kaczmarek, who's written critically of the constitutional right to same-sex marriage and whose past rulings included one rejecting explicit health protections for LGBTQ people. The route to the Supreme Court for this case could be quick, but in the meantime, the ADF has asked for the use of the drugs to be enjoined while the case is being heard. I'll be covering this fight for abortion access quite a bit this year, so I'll be returning these stories when news breaks. Until then, here's my conversation with Robin Marty, recorded in January, before many of these stories broke.
My name is Robin Marty. My pronouns are she and her. I live out in Tuscaloosa, Alabama, where I've been living for the last 2 years because I am running the West Alabama Women's Center, which prior to the changes last summer was the largest abortion provider in the state of Alabama. Now we are providing reproductive health care. We're providing follow-ups for people who may have self-managed their own abortions or who are afraid to go into the doctor or simply are unable to go into the doctor because the healthcare system in Alabama is awful. Prior to that, I was a reporter and my jam was doing tracking laws that were meant to overturn Roe v. Wade and embedding with anti-abortion activists. I'm also the author of Handbook for a Post-Roe America and The End of Roe v. Wade.
Well, you called that one, didn't you? That actually, I didn't even have this question written down. But why? This is a question because, like, everybody I know, like within the world that I work in, like the pro-choice, reproductive rights world is kind of a side world that like Liz Winstead kind of dragged me into.
Yeah.
And everybody I've ever talked to was just like, well, this is what's going to happen. Like, well, this is not a question. Like, why is no one? Obviously, Roe v. Wade is going to be overturned not just within our lifetime, but like within a short
Yes.
amount of time. And like, it seemed like everybody I knew saw the writing on the wall, but everyone else in the media, and literally people that I work with in different worlds, were like, oh no, they would never dare to turn that over. They would never do that. And I'm like, yeah, they're gonna.
Yeah, I think that a lot of it had to do with the fact so even in the reproductive rights movement, it took a while for people outside of red states, in all honesty. And I was a blue stater at the time, outside of red states, to really get it, because they did not understand and were not studying what the long game was for anti-abortion activists. So for the first time that we wrote End of Roe v. Wade, it had a different title, and it came out actually 10 years ago this week. And that time when we wrote the book, we were explaining all of these new laws that had just popped up within the last couple of years that were meant specifically to provoke some sort of court circuit split so that they could get a case up to the Supreme Court. And they were hoping at that point to be able to convince Justice Anthony Kennedy that he should overturn Roe v. Wade. And when we were talking about the end of Roe v. Wade, what we meant at the time was that the protections of Roe v. Wade would be gone, as in, okay, so abortion will not be protected from the point prior to the point of viability, the way that it is supposed to be right now, or was supposed to be before Dobbs was decided. We saw all these states that were introducing these bans, like heartbeat bans, where abortion would be banned at 6 weeks, or where they would have multi-day waiting periods. There were not supposed to, according to Roe v. Wade, be any restrictions on first trimester abortions. There were supposed to be minimum restrictions on being able to access a second trimester abortion, and then it was third trimester, where it was inaccessible except for threat to a pregnant person's life. Yeah. All that the right was trying to do back in 2013-14, they were trying to get one law that could make it up to the Supreme Court that would make some sort of ability for the states to be able to say, okay, I guess you can actually have a total abortion ban prior to the point of viability, which at that point was expected to be around 23 weeks gestation. So they were looking at things like these 20-week bans, and that was what we originally thought, that there was going to be a 20-week ban that was going to end up going to the federal court. The court would say, okay, I guess actually you could ban abortion at 20 weeks with no exceptions. And that officially would be the end of Roe v. Wade, because Roe v. Wade said you could not have a blanket abortion ban prior to viability. Like, this was the big doomsday scenario that we saw coming, thinking that when that happened, states would then be allowed to say, okay, well, what about if we wanted to have a 15-week ban? What about if we wanted to have an 8-week ban? And because that barrier would have been broken down, that was the end of Roe v. Wade and that protection, and states could start to ban whenever they wanted. What we did not expect was that this quickly, primarily because of the 3 justices Donald Trump was able to put on the Supreme Court, that we would suddenly be approached right out in front with this idea of states being able to completely ban abortion all at once. That was not a scenario that we saw even in the road in front of us within the next decade or so, until Amy Coney Barrett ended up on the Supreme Court. And that was the moment we realized that the end of Roe v. Wade wasn't, okay, we've lost the protections of viability. It was, oh shit, we are going to have states that are going to make abortion completely illegal altogether.
Yeah. And it's just kind of, because it's like, as a fellow journalist as well, like you go to the actual meetings, and you're going to just slide in there and they just say the quiet part continually out loud. Like I went to last year at March for Life, I went to a lawyers meeting, basically.
Oh yeah.
And oh my goodness.
Law summit the day before. Yes. Yeah, I used to go to that one all the time.
This one, well, what's shocking, it's a whole different story about like the fact that they're mixing in, well, this is why election integrity is important. It was just like, wait a minute, what? Like 2 worlds are combining. But it's just like the obviousness of like, well, the next step is obviously we're going after the pills, and next step we're going after this, and and of course the idea, this overhanging thing that even Donald Trump came out and said at one point was, of course you have to prosecute the women, and the fact that all of this is kind of been out there, but like if you talk to the March for Life organizers, are like, well, no, this is the only thing that we wanted was Roe versus Wade overturned, and we're happy and we're kind of good. And And for some reason, everyone's kind of believed it. Like, I don't want to criticize. It's a good article. The Washington Post article was kind of like, well, this is what these organizers said, and they're not doing that. They want to go after the thing. Well, first off, it's de facto. If you go after the companies that are doing this versus you go after the woman, the end product is the same, right?
Mm-hmm.
Yeah.
Well, and the thing that's really interesting is, yes, you have like your Jeannie Mancini and Kristen Hawkins and everybody saying, you know, the person who is having the abortion is the second victim. She's the one who's vulnerable. She shouldn't be held responsible. First of all, that's paternalistic bullshit. Yeah. And they need that because that feeds into their idea that no person really wants an abortion. So really they're doing it to protect people, which we all know is not true. I can tell you almost every patient that came into my clinic wanted an abortion. And those who did not want an abortion, it was because there was something wrong with the fetus. Yeah. So people want abortions. People do not want to be pregnant. People still call us up and ask us for abortions, knowing we could be put in jail. They could be put in jail. They don't care. If they think that we might do something, they're still going to call and at least try. So right now we've got a situation where I think Alabama is really showing that tension between the public approach and the private approach in the anti-abortion movement, because here we have an attorney general who did, in fact, say the quiet part out loud that, okay, we may not be able to put a person in jail for doing medication. We may not be able to put them in jail under the Human Life Protection Act because that exempts them. But hey, we can still possibly put them in jail under chemical endangerment because this person is ingesting a chemical that is endangering the life of the unborn child inside of her. And so he said that. And he very blatantly said that. And then ever since then, he's been trying to walk this backwards. But the reality is people are like, oh, he's changing his mind. He's looking at this in a different way. Until today, there has been no statement that has come out of his mouth that actually does walk that backwards. What he has said over and over again is what we're really looking at is how to prosecute the person who gave the medication. But he doesn't say we're still not going to prosecute her. And until today, that was something that he had very specifically threaded the needle on. I guess last night he did a radio interview that I just saw now, where he specifically said that no person should be prosecuted. When he was talking about the chemical endangerment law, he meant if a person, say, ingested a bunch of methamphetamines, which is already something that they can arrest her on under chemical endangerment. If she does that and it causes an abortion, she can still be arrested for chemical endangerment. Yeah. He says that. I still call bullshit, although I'm going to, of course, say it as loudly as possible that this is the thing he said, so that when he doesn't do it, then exactly. We all know that he was a liar. But the reality is, when we talk about the chemical endangerment law in Alabama, this is not a thing that people are using in order to protect children from the meth lab that is a womb, which is allegedly what it was set up for. This summer, we had National Women's Law Center actually come in and get a number of pregnant people who were being held in a jail released because they had been held in jail because they had been, they tested positive for marijuana. And so they were put in jail because they were tested positive for marijuana, were pregnant, and they could not be released under this chemical endangerment law until they were put into an outpatient facility, which none of them could be put into because they did not meet the criteria for being sent into an outpatient facility for drug use.
Never mind the fact that what level marijuana versus being in a prison cell, what is more endangerment to your child?
Exactly. And that's the thing that is so frightening, because right now what we have is a state, and understand that this is a state that still has not expanded Medicaid out here. There is almost no access for a person who is uninsured to be able to obtain birth control in order to prevent pregnancies. Obviously, we do have problems with addiction out here, and there are no places for people to go and actually get into a place to be safe. In Tuscaloosa, people go to Birmingham just to get OBGYN care because there are no doctors out here that they trust. And that's something that we've really been trying to address as a clinic, saying, here, you can come to someone in this city. We are not going to turn you away. We are not going to ask you questions and then turn you over to the police. We're not going to do any of these things that you've come to expect your doctors to do. And so when you put all these factors together, and then you have a chemical endangerment law that essentially your state is using to say, you are a pregnant person. We know you are pregnant. We don't care what you're going to do in the future. We have just decided that we need to use this law to lock you up in order to protect that infant until the point in which it comes out of you, in which case we're going to take it away because you just lost your rights because you've been in jail.
Yeah. Yeah. It's amazing to watch because I mean, for years we had people that were elected that didn't necessarily believe in the like adamant anti-abortion, like on a larger scale, obviously not in Alabama or a lot of particular states. But now they're electing true believers, and
right.
That people that are like not just true believers but like embedded in the movement, and now they can't. But they still have to like legislate on a larger scale, and it seems like that. Thankfully, it's coming up to a little bit of head in at least in my state in Virginia. Like there's a legislator who proposed a pregnant woman has to register her pregnancy with the Easy Pass system and then can ride in the HOV lane. That's okay. Like, haha, funny, but it's just like, wait a minute, you're registering your pregnancy with the state.
Yeah, that's bad. Don't register your pregnancy. That's how it starts. Yeah. Well, and the thing is, what I've been trying to tell people, and I started it last year, and it just becomes more and more clear, is that people write off Alabama, which I get, and also it pisses me off because this is the birthplace of the civil rights movement. Like, if you give us the ability and some resources, we have power. Yeah. But also Alabama is in essence the first wave. And so in 2018, they passed a personhood amendment. We are the only state that protects an egg from the moment of fertilization in the nation. Yeah. And that's what's bringing about chemical endangerment and all of that. In 2019, we were the first total complete abortion ban, and now we're seeing them everywhere. So of course you need to watch this, because now you know that anything that happens in Alabama, if it does not get stopped, it's going to be everywhere, because they are all cut from the same cloth.
Yeah. I mean, states like Alabama, Mississippi, even Georgia now, even though they really, really want to push this message that Georgia is turning blue. But as somebody I've just spent a ton of time in Georgia the last couple of years, and
it's hard.
but the fact is that they have been on the forefront of all of this stuff in the way, but exactly. It quietly, Brian Kemp has been pushing it. CRT, he's been pushing all the DeSantis BS. He's been pushing it, but he's been doing it in like a nice, quiet, conservative way, just like my governor, who's for some reason name I can never remember. My governor here in Virginia.
Youngkin.
Yeah, Youngkin. He's doing the same thing, and just doing it in a very quiet way, wearing a sweater vest, and no one's bothered by it.
And
because it doesn't match
it doesn't match the tenor of what people think of their states. But I mean, also, if you go back though and you look, Mississippi in 2013, I believe it was, had a ballot amendment for personhood, and that amendment lost. It lost blatantly. I believe it was 66-33. People did not want it. That's what led to the need to start doing the trap laws to try to actually close down the only clinic there, because they couldn't win on the ballot. So if you look at the last election, it wasn't the last election because there's been elections since there. But if you looked at 2020, in that election, Mississippi came surprisingly close to electing a Democrat to the Senate. Mike Espy almost won his race. And like, the reason that we are not getting these leaders, obviously, is because of how voter disenfranchisement works down here. Alabama is one of the only states that will not let a person who has ever been convicted of a felony ever get their voting rights back. Alabama has absolutely no early voting, no mail-in ballots, no absentee ballots. The only thing you can do is you come in on that day of election and you have to vote that day. It doesn't matter what's going on. It doesn't matter what's going on in your life. It doesn't matter if you are mobile, nothing like that. You just vote that day. Of course, all that ever gets elected is a bunch of Baptist Republicans.
Yeah. No, it's sad that people can't look to the like kind of the localized and see that the vote. Yeah,
we're trying so hard, man.
Yeah, no, it's kind of shocking because it's like, I mean, obviously, like I fall into the trap of like, well, it's Alabama, well, it's the South, it's whatever, but it's even as somebody who covers voter suppression since I was in my mid-20s, and like this idea that it's just part, it's not even voter suppression at a certain point where it's just, no, that's just the way the system works in a lot of these states. And you go, well, of course this is where we are. But.
And we're all so used to the idea of government oppression down here, especially the populations that are the most vulnerable. Like, one of the things that people have been asking me a lot is, so what does it look like? What are people doing for abortion out here? Are they leaving the state? Are they getting illegal abortions and coming to you? What is happening? And the reality is, obviously, we're seeing what we're seeing because people are scared, but the people who come into us and who talk to us, for the most part, are just staying pregnant because they see this as just another way that the government is taking over their lives and that they have no power against, and they're just resigned. Just like they are resigned to knowing that they may not always have clean drinking water, or that their schools are going to suck and there's nothing that they can do about it. They're resigned to knowing that they're always going to be represented by Republicans because they can't get out to vote. Yeah. They see this as another assault of the government on them, and that there's really nothing that they can do. And that's what breaks my heart.
Yeah, no. I mean, I remember seeing a bunch of liberals, like, I just literally straight up like on Twitter, just saying like, well, why don't they just move? Why don't they just move out of that state then? You're just going to have to move. And it's just like, oh God.
Well, and it's not even just the fact that this is, I mean, for a lot of people, this is their family, their history. Yeah. I don't think people understand how the system down here is made to create poverty, like purposely create poverty. We have a 10% grocery tax on everything. Like, that apple that you get at the grocery store, that has a 10% tax on it. We don't have schools. There are a couple of magnet schools. The public schools are impossible. They are really horrible. That's purposeful. And even better, they're paid for with that alleged 10% grocery tax. So anytime somebody says, can we get rid of the grocery tax? They're like, why do you hate public schools? But the public schools are awful. And so anyone with any means sends their kid to private school. There is a tax on everything in life down here. And of course, nobody can ever get ahead in order to even get together the materials to move, even if they wanted to. And you should not have to leave your state to have rights.
Yeah. Also, there's the argument that you should you could stay and fight because that's otherwise you just end up leaving everyone else behind. I mean, that's something something that people should think of as well. But
and it's really hard too, because you also have to figure out like where your place is in it, because I mean, like, it's difficult, and I'll be honest about this. I have really complicated feelings right now about being here, because I am in fact a Northerner who came down here with this misguided white savior belief that I was going to somehow make a difference and help. And I mean, this isn't what I thought it would be. Yeah. And it's because of my own blinders on things. And so understanding like where my role is in this. And honestly, my role right now is to make sure that people don't die. It's to make sure people get health care. I would love to change the political system as well. But right now, it's a matter of life and death and immediate need. And that's the problem down here, is that because everything is so tenuous, there is so much that needs to be focused on immediately to make sure that people just don't die, that trying to politically organize and move forward, that is so difficult.
Yeah, no. I mean, and now you have like the national kind of, Boston, we live in a world where the Boston Children's Hospital is getting bomb threats and death threats on a constant basis. So it's like, anytime you try to make it about a bigger issue is the moment that you're going to get targeted by,
we're an abortion clinic. That's a thing we know.
Exactly. Yeah, no, obviously. No. So actually, here's a question. What other help? Because I mean, this is something I think that people like Planned Parenthood, just does abortions. These clinics, that's all they do is they just, kill babies and that sort of thing. What sort of healthcare do you provide at the West Alabama's Women's Center?
Oh, sure. Yeah, right now, we have spent the last 6 months essentially, ever since jobs, revamping ourselves in order to be essentially a sliding scale and free clinic for anyone who needs it. So, most of what we're doing is providing free or low cost birth control. We have IUDs that actually have been sponsored, so we can give those away, which is really amazing because IUDs out of pocket are actually like in the thousands of dollars. So we have birth control. We also do STI testing and treatment. We can do anything by telemed that a person might need. We're doing hormone therapy for those who are transitioning. We're doing PrEP and HIV treatment and testing for populations. We've been working really closely with the Knights and Orchids Foundation, which is a Black trans-led group out of Selma, Alabama. And so we've been providing PrEP services, which is HIV protection services for a lot of their patients. And so essentially anything that is gynecological, anything that can be dealt with by a family practice doctor, we're doing all of that here in-house in order to make sure that people can access care even if they don't have insurance. We also were approved as a Medicaid provider, so we're able to help provide both first primary care and also birth control and sexual health care to those who are either on Medicaid or on Plan First, which is the slightly expanded version of Medicaid for people who need birth control.
Yeah. And I've already taken up more time than I asked. Where can people find where can people support? This is I make it actually a wider question. A lot of people, I donate directly to clinics now, as opposed to donating to the larger, I won't mention them, larger groups. That money takes a long time and in different ways doesn't filter down. At least in my experience in talking to people, what is the way that people can most, if I'm going to donate $50 somewhere, what is the most effective way that people can donate?
If people want to donate to us directly, you can go to our website, and the easiest website is still alabortionclinic.com. And we still have that website, even though we do have another one set up at alreprohealth.com. There's a place there that people can donate, and we are a tax-exempt organization now. There's also a place, if you scroll down past where all of our services are, where you can see a link to sign up in order to get our newsletters. And we do updates about what's going on in Alabama in the surrounding area and how people, even if they're outside of the state, can get involved in order to hopefully try and make some of this right.
That's great. And of course, where can people find you and your work?
People can find me primarily on Twitter, Robin Marty. And I probably am not going anywhere because it's just the easiest way to reach people. So unless Twitter goes down completely, I will still be there sharing news and basically being loud.
Great. And thank you so much. Thanks for your time.
Anytime, Zach.
Yeah, thanks. Thank you so much, everyone, for listening. This has been the vsu.news podcast. You can now go to patreon.com/ZDRoberts and get our show just a couple days early. And also, you can just support our work in general for just as low amount as $1 a month. I mean, come on, that's nothing. That's not even a cup of coffee. And you can also now go to our Substack. I believe that's what it is, at least. Anyway, but search us VSU News. It's vsunews.substack.com. And you can always find me at ZD Roberts on Twitter, assuming the site doesn't implode anytime. Whatever. But thanks again for listening. See you next week.